So I just want to talk to you today about GLP-1s, as it's all the rage on all social medias, and everybody is giving you opinion, from just influencers who might be life coaches, personal trainers. There are some physicians, and it's not just GLP-1s, but it's GLP-1 GIPs, and then there's Retta on down the pipeline. So using these medications, originally they came out for treatment of diabetes, and then we realized that it's great for weight management, but it works on so many different areas of the body. So it isn't just about appetite suppression and slowing the stomach down, because there's even people who don't eat a lot and already are exercising still can benefit from a GLP-1. So it ends up that just talking GLP-1s, but it's sort of a broader on all of those receptors, that it's actually not just a receptor in the gut or a receptor in the brain. We actually have receptors throughout the body. So brain, cardiac, muscle, kidney, bone, and it has different effects everywhere. Basically, what we're finding is not only is it, yes, helping with metabolically, with treating diabetes, but also cardiovascular disease. It's nephroprotective, which means it protects the kidneys. In the lungs, we're finding that patients are having better asthma control, and it reduces neuroinflammation. So people might get better with insomnia, depression, anxiety, improves sleep. It helps with addictions, whether it's alcohol, pot, gambling. So it is actually an amazing group of drugs. There are peptides as well that can be very helpful for many different reasons besides weight. And at Vitality, we're one of the first Canadian clinics to start microdosing, because for all these other benefits, I'm not sure that we actually need to use high dose. And in fact, when you flog the system, it eventually gets resistant, just like insulin resistance. We got leptin resistance. Well, there's a lot of people deficient on GLP-1s, but also a resistance can develop. And that's where you see people who are on it and they're not getting all the benefits they used to. And where I love using GLP-1s or those peptides is to really help with inflammation in general, neuroinflammation, body inflammation, MCAS, mast cell activation. So it's a great tool in my toolbox, but it's only one piece of the puzzle. Again, if you don't eat enough, don't get enough protein, if you aren't exercising, if you aren't managing your stress, you're going to not just lose weight, but you're actually not necessarily improving your body composition, which is so important. So it's not GLP-1s that are specifically causing muscle loss or bone loss. It's the actual weight loss that does. So in general, people lose 20 to 30% of their muscle mass when they lose weight. So you lost 50 pounds, well, 20 to 30% of that is muscle. And guess what determines our basal metabolic rate? It's our muscle mass. So actually, low-dose GLP-1s actually has muscle preservation. And if you exercise, you can help maintain that weight. And actually, we use a lot of mSculpt Neo when our patients are microdosing, and it's amazing the results that we actually get way more muscle development. We lose fat. And so the patient's metabolically better, and their body composition has actually improved in time, where if you're just using it and that's the only thing you're doing and you're not getting enough nutrients, you're not replacing those deficient nutrients that make the body work effectively. Down the road, yes, you're going to be thinner, but you actually may have sarcopenia, which is lack of muscle mass, and that actually is a determinant of health and can interfere with your longevity. So doing all the things, building muscle, protecting your muscles, and dosing appropriately, and also changing it up so your body doesn't get stuck. Again, at Vitality, this is our expertise. You do an amazing job on not only just helping people lose weight, but actually feel better and improve their longevity.